The ongoing COVID-19 pandemic has had a massive impact on people all around the world. Many services on the impact of COVID-19 were developed and launched after the beginning of the crisis. But even when they addressed areas which are of particular concern for intersex people and their families, the still prevailing lack of awareness about intersex people and intersex lives makes it challenging for this service to collect meaningful data or to collect data at all. Many intersex people reported that the available COVID-19 service did not address the specific challenges created or aggravated for them by COVID-19. This encouraged the international intersex community to take action. Today we are presenting reports from 4 different regions. You will hear from Africa, Asia, Europe and Central Asia, and Latin America. The reports talk about the impact of the pandemic specifically on the lives of intersex people and their families in their region.
Hi everyone, my name is Obioma Chukwike. I'm the Executive Director of Intersex Nigeria and a member of African Intersex Movement. I'm here to share with you findings from the COVID-19 report, African COVID-19 report on the situation of intersex people in Africa in COVID-19. In 2020, the world was thrown into turmoil at the outbreak of COVID-19. A lot of countries were shut down. Many people died, millions of people died, and people are still dying from COVID. The Global Intersex Committee deemed it fit to assess the situation of intersex people around the globe. The African Intersex Movement saw it as a good step. I was privileged to author this report, and I'm here to share some of the findings with you. COVID-19 global pandemic affected everyone, affected every nation. An intersex community was not left out. This report, through the survey, was able to gather quantitative and qualitative data pool that was able to help us compile this report. This report does not show all intersex people in Africa. This does not represent all the intersex people in Africa, but it has a good representation as the survey was gotten from 9 African countries. The vulnerability rates of intersex people increased, and some of the factors that increase this vulnerability rate includes gender identity and expression, economic status, sexual orientation, citizenship, HIV status, cultural, religion and faiths. The areas of life impacted by COVID-19 was also looked into in this report. And some of the areas include finance, mental health, intersex activism, employment, housing, personal safety, health, human rights, traveling. And in all this, the finances and economic situation of intersex people in Africa was highly hit. According to the respondents of the survey, their finances and income was really on the line in COVID-19. A lot of intersex people indicated that they had income reduction and severe income reduction. They weren't able to spend money as they did before COVID-19. They weren't able to buy basic needs. And this can be seen because the employment rates also dropped. This report also showed that there was a lot of salary reduction of intersex people, and many intersex people lost their jobs. From this survey, it was indicated that a lot of people were not able to have means to take care of themselves. They had to rely on people in COVID. Apart from people losing their jobs, businesses, clients, high risk workers were not able to access work like before. Work became dangerous for high risk workers. From the reports, it was indicated that 44% of high risk workers said that their jobs became more dangerous. Mental health and well being of intersex people were heavily affected. Many did not expect the pandemic and related restrictions. Mental health, because of isolation, lockdowns, social isolation, increased feeling of anxiety and fear. A lot of respondents say that their mental health were worsening, were worsening and worsened strongly. And in the midst of their mental health being affected, they were not also able to access professionals at that moment that could be of help, maybe psychosocial supports, and those that maybe could access it said they did not have the fund, they don't have the money to do that because already they have lost their jobs, they could barely feed themselves, and all that. Also, healthcare was not left out. Many respondents indicated that amid the pandemic, access to good health services became critical. Many did not have access to doctors that have expertise on their intersex body. Doctors' appointments were either cancelled or postponed because many doctors channeled their effort in treating COVID-19 patients. And this affected a lot of intersex people who already have pre-existing medical condition. Some do not have the money to get medications. Some said that there were no longer availability of medications at the pharmacies where they normally get medications. For example, people that are already on ARV and all that. So it became a lot of issue in COVID for intersex people in Africa. Support. We know there were a lot of lockdown restrictions, travel restrictions, so a lot of people depended on support. And intersex people, through this survey, said that no support came from the government. They did not get any means of support. Almost 69%. 69% indicated that no support came from the government. A few, about 3%, said that they got support from the government, but the process of getting it was very difficult for them. And we all know that during the COVID-19, there was a lot of restrictions, movements were restricted, so there were no in-person community engagements, were not really as it used to be. Some said they participated in several calls, and some don't have access to internet to participate in online events. So it became a whole lot of situation. Safety and human rights. The safety and human rights of intersex people were heavily affected and impacted in COVID-19. Many people, had to stay with people that they were not comfortable with, maybe family members or friends who they didn't want to stay with for a long time. And those people became hostile and the place became unsafe for them. They were being treated poorly, violated their rights, beaten, harassed. And people got harassed on the streets too, people that don't have nowhere to go to. People that turned back to their family also indicated that some of their families traumatized and stigmatized against them because they were intersex. So, and many also indicated that their neighbors also harassed them because of the restrictions and lockdowns. So the hostile nature of intersex people in Africa was increased. Personal safety became a problem. Staying at home, self-isolation with someone that either they have a strained relationship was high, experienced violence, abuse, harassment on the streets. The respondent was high on this. The pandemic affected their whole existence. Intersex activism was not left out. Before COVID-19, intersex activism has and always suffered huge neglect. And in Africa, this was not left out. Intersex activism has been on the verge of, you know, many intersex-led organizations operate with little or no funding, little or no funding. And this makes work very difficult. In COVID-19, with the restrictions, with the lockdowns, people were not able to do projects that they wanted. They were not able to reach out to communities and all that. So intersex activism also too was highly impacted. A lot of intersex people don't see a normal future after this pandemic. From the respondents, a lot of intersex people feel like things are going to change. Restrictions are still going to be there. There's going to be a lot of changes in how people relate with people and all that, and which is happening already in 2021. In conclusion, we can see that if you're able to access this report, which I urge everybody to access this report, the link will be shared. You will see that the financial, employment, economic um, status, access to healthcare facilities, mental health and well-being, safety were seriously undermined in COVID-19. Intersex people in Africa were heavily and seriously impacted by this COVID. Before COVID, intersex people in Africa have suffered a lot of human rights violations. They have been victims of on, you know, on consensual negative treatments. These memories still live with a lot of intersex people in Africa who have suffered stigma, non-consensual treatments, pathologization of their body, not allowing them to self-determine who they want to be. And COVID-19 brought out these realities to our faces. And this survey and this report is showing it also. Intersex people in Africa and also around the world need government to intervene, to show solidarity, to protect their rights, to show that intersex people are so human beings who are born naturally and need to self-determine who they want to be, who they want to gender identify, who they want to sexually orientation identify, who they want to, associate with. They have the right to have access to good health care. They should have the right to have access to all social benefits, just like every other citizen of their countries. Intersex babies should be given the right to grow and self-determine who they want to be. In Africa, there's a lot of myths and misconceptions about intersex, and these have affected a lot of intersex people from evolving, from being who they want to be. If you go through this report, you will notice and you will see that it is a call for action. It is a call that intersex community are being brought closer and listened to and understood better. I call upon the international bodies, government agencies, local agencies to put hands together with the international community globally, both in Africa and other continents, to bring a stop to a lot of human rights violations. And also, intersex activism is suffering. A lot of funding is needed in intersex activism and advocating. Advocates and activists of intersex rights work with little or no funds. Intersex-led organizations work with little or no funds. In Africa, as an activist, I can testify that the work here is huge, but the funds access to it is just little. With this, I will conclude and I will say, please join hands with intersex community to make intersex people have the rights they deserve. Thank you.
Dear distinguished participants of the Worldwide Copenhagen 2021 I'm Heike Cho, the founder of OI Chinese since 2008. Currently serves as the chair and the executive director of Intersex Asia. Intersex Asia is the first and only intersex-led network organization defending intersex human rights, established in 2018 with intersex activists from 10 Asia countries. Thanks for the invitation to share the first regional intersex survey report conducted by an intersex-led organization in Asian history. Our COVID-19 report, Invisibility Amplified, a report on the impact of COVID-19 on intersex people in Asia, is a result of global collaboration from the intersex community and a precious action of intersex solidarity in the region. The pandemic did and is continuing massive impact on intersex people in Asia. The survey helped us to learn more and build evidence of the real difficulties intersex people face on the ground. The report had been launched this June. You can download it from our website, intersexasia.org. Before I start, I want to thank OII Europe for initiating the COVID-19 survey specific to intersex people, sharing their questionnaires with other regions, and calling for global collaboration to this survey. Special thanks to Irene and Dan from OII Europe, who supported us in dealing with all issues during the survey and do the perfect proofreading for our report. Their sincere and serious attitudes help us deepen our perspectives. It is an impressive learning experience for us. I also want to thank our coordinator, Prashant Shinai, who compiles the survey into our first regional report. Intersex Asia revised the questionnaire with Asia context input by our member organization. Since intersex awareness is still absent pervasively in Asia, it is challenging to make the survey reach the intersex community. Thus, the role of intersex-led organization and ally are significant. Our member organization leaders help us translate the questions from English to their local languages for their members to understand and fill their answer through the internet and phone call, one by one. It helps us overcome the issue to confirm the participants are intersex and the family members of intersex, and also language barriers. So 79% of participants of the survey are from our member organizations. One of our allies helped us complete one survey in the same way. It took them more than 2 hours to complete. Without building an intersex network with support from intersex-led organizations and allies in 2018, it is hard to imagine having an intersex survey with 45 intersex persons from 9 countries in Asia. So, sincerely thanks to our allies and the member organization. You all made the survey possible. Besides, the urgent fund distributed to 95 intersex people for COVID-19 by Intersex Asia through member organization early last year is also helpful for conducting the survey. It creates a bond between Intersex Asia and the intersex community of our member organizations. Encourage intersex people to participate in the survey. The survey covers 10 areas, including physical health, mental health, education, finance, employment, housing, travel, personal safety, human rights, and intersex activism. Overall, the top three impacts are finance, 65%, mental health, 45%, and employment, 43%. Due to lockdown, people who earn daily wages lost income suddenly. 24% of participants face survival issues. 30% of participants who have jobs face serious income reduction. Some participants report that they face domestic discrimination and violence, were even kicked out by their families due to the financial issues. 65% of participants said COVID-19 had a severe impact on their financial situation. The financial crisis also impacts mental health, employment, and education. In response to the risky situation, there is no financial support from the government in regard to COVID-19. 54% of people also said that they did not get any support from the government during the pandemic. On the contrary, 59% of participants stated that they received financial and other kinds of support from the intersex organization. During the pandemic, social discrimination impacted both health access and the mental health issue further. 15% of participants said that they were unable to seek treatment for COVID-19 infection due to fearing of discriminatory behavior of doctors and which could trigger their past trauma. One participant said doctors still make jokes about intersex people. 66% of intersex people report that they were unable to access medical institutions that are equipped to address the specific needs of intersex people. In Asia, hardly any medical or mental health professional is equipped with proper knowledge about intersex condition, not even mention intersex human rights issues. More than 66% of respondents experienced worsening of their mental health during the pandemic. Jobs in the informal sector have almost disappeared, causing a threat to survival of many intersex people. 82% of respondents are getting fewer contracts because of the economic impact of the pandemic. And many respondents said it is tough for them since they do not have stable savings. Livelihood emerges as a difficult issue for intersex people in Asia. Till now, there have been no formal statement from national governments, developmental institutions, or intergovernmental organizations recognizing the impact of the pandemic on intersex people. We hope our report can be taken as a key reference for the national governments in Asia. From the report, we can see the vital role of the intersex-led organization. They could reach the intersex community quickly, identify their difficulties and the need, and provide support in a sufficient time once they got the resource to support. We also learned that intersex people in Asia is totally left behind by the governments and all private sector that could provide possible support. Intersex invisibility is amplified here, not only to the general public, but also to the government level. We want to call for intersex awareness to all Asia governments and encourage them to work with intersex-led organizations to include intersex in policy, respond toward the pandemic. intersex-led organization can help build the bridges and fill the gaps. Please do include intersex people in the protection and let us help. Thank you.
Hello, my name is Varin Kuzemka, I'm from OII Europe. The European survey has been conducted in the summer of 2020. 63 people participated in the survey. We want to full-heartedly thank the members of the European intersex community who responded to the survey, the intersex individuals who supported OII Europe in the development of the questionnaire, and last but not least, our incredible translators. The quantitative and qualitative data together strongly point towards intersex people being a highly vulnerable part of the population in the context of COVID-19. One of the most important findings in this respect is the highly increased risk for intersex people to not be able to access health care due to their history of medical trauma, even when infected with COVID-19. The high percentage of increased mental health issues among the respondents represents another worrying, though not surprising, finding, as mental health issues acquired by intersex people through the violations of their physical and psychological integrity and through the stress of living invisible, in isolation and with stigma and taboo, make intersex individuals more vulnerable. In addition, the pre-existing lack of educated psychological counseling makes it harder for intersex people to receive help. This situation has been aggravated during the COVID-19 crisis. These results are in line with the surveys and studies about the increased vulnerability of minority groups in times of a pandemic and COVID-19. Minority stress caused by discrimination experienced in everyday life, as well as the economic and social inequalities caused by the structural discrimination, act as a negatively aggravating factor on the capacity of individuals to stay physically and mentally healthy in such times of crisis. The findings of this exploratory study mirror these well-known facts to a worrying extent, and therefore make a strong call for the need for further educated and intersex-focused research. Overall, the survey findings showed that the COVID-19 pandemic had and continues to have a massive impact on all areas of lives of intersex people, with the negative impact in the areas of mental health, general access to healthcare, and on intersex peoples and their families, work and financial situation being the most prominent. Medical trauma acquired through unconsented, non-vital medical interventions and treatment impacts strongly on intersex people in this pandemic. Intersex people's problems are amplified during the COVID-19 crisis because they relieve their previous trauma through actual contact or being at risk to be in contact with medical doctors and hospitals, aggravated because the societal and medical environments do not account for their trauma. Regarding the pandemic's impact on financial situation, many intersex people are experiencing financial problems and/or income reduction as a result of the pandemic, with about half noticing that they have to spend more money during the pandemic. Some survey participants lost their job due to the economic crisis or had to quit their job because of their mental or physical health issues related to COVID-19 pandemic, with a few facing severe housing problems as a result of their financial situation. Several participants of the survey are staying at home in self-isolation with someone whom they have a strained relationship or other difficulties with. On a personal level, the pandemic is severely impacting intersex activism, and there is a high risk that the situation will aggravate with each month the crisis continues. The pandemic is preventing intersex activists from using in-person methods of building community, raising awareness, and advocating for intersex human rights that they have created. With an extremely high amount of volunteer work still being the core of intersex activism, the need of many intersex activists to refocus their energy on their personal financial survival directly impacts the capacity of the movement to work towards intersex people's rights in Europe and Central Asia. For many of those who continue their work, the new digital norm brings an additional factor of stress that can be detrimental to their health in the long run, such as the tiredness and exhaustion induced by online meetings, especially if these need to be taken after already a long working days in digital environment only. Others may be prevented from fully engaging in the new digital normal as a result of the lack of financial capacity to get the necessary technical means. On a positive note, the majority of respondents were in touch with other intersex individuals and intersex organizations and groups on a regular basis. While on one hand this can be considered as a result rooted in how the self-selection of respondents took place, it still shows that the bond intersex people have built in the past few years and the intersex movement in Europe and recently Central Asia is strong enough to hold even when faced with a crisis. This is not guaranteed in all movements, especially not with a community that has a history of isolation, taboo, and shame to overcome. But resilience can only carry a movement so far. For the rest, this movement, the European and Central Asian intersex movement, needs the means and the capacity to proceed while staying strong. It needs encouragement, protection, and last but not least, sustainable funding during the crisis and beyond. Thank you so much.
Hola, soy Gaby, represento a la organización Orquídea Intersexual, Organización Intersex Argentina, que junto con el GALAC, la Organización Internacional Intersex Europa, y Brújula Intersexual, hemos impulsado y trabajado sobre la encuesta COVID-19 para hacer una presentación y conocer las necesidades de la comunidad intersex en toda Latinoamérica. Esta encuesta fue trabajada en conjunto y impulsada por estas organizaciones para tener conocimiento en torno de las necesidades de este grupo social. La Organización Intersexual Internacional, la OII Europa, ha impulsado la encuesta COVID-19 para hacer una presentación en Copenhague en la Conferencia Mundial LGTBI que será llevada a cabo este 2021. La encuesta COVID-19 se impulsó a través del Comité Internacional Intersex, en donde la OII Europa presentó la propuesta para que las organizaciones que formamos parte de ese espacio pudiéramos trabajar y presentar informes en torno de las necesidades que está atravesando la comunidad intersexual latinoamericana en el avance de la pandemia producida por el COVID-19. El total de la muestra ha sido considerada en 80 personas, considerando personas intersexuales y familiares de personas intersex, quienes pudieron responder y participaron de la encuesta. Un porcentaje del 60% de las personas presentó una respuesta en torno de la vulneración en relación a sus niveles económicos y niveles de acceso al empleo como una situación en la cual se ha visto afectada a partir de la vivencia de la pandemia. De esa cantidad de personas, un 30% se mostró vulnerable según su orientación sexual o expresión e identidad de género. En líneas generales, un 40% de la población responde que la pandemia COVID-19 le ha estado afectando o le afecta en torno a su nivel de salud y salud mental. En un cerca del 54% hace mención que le ha afectado en su acceso al empleo y su nivel económico, mientras que también menciona que el aspecto educativo también se ha visto afectado más o menos en un porcentaje del 20% que hace muestra de la vulneración y las situaciones complejas atravesadas debido a la pandemia. En relación al nivel de salud, las personas mencionan en un 30% que tuvo que suspender sus consultas, suspender o bien atrasar sus consultas al médico, mientras que un 49% de la muestra evidencia que debió dejar de asistir a la atención clínica por no encontrar médicos que conozcan sus necesidades de salud y comprendan su corporalidad. Entre tanto, mencionan de que muchos dejaron de asistir debido a que no sienten confianza en la atención clínica médica en torno de sus condiciones de salud y en torno de su propia corporalidad. En relación a los servicios de salud por posible infección de COVID, el 38% hace mención que no ha tenido aún problemas de infección COVID, mientras que un 10% menciona que ha experimentado una situación de infección COVID, en la cual debió recibir tratamiento, mientras que en su generalidad la gran mayoría de personas hace mención de que considera de que no tiene servicios adecuados en su país frente a la condición infección COVID. En relación al acceso a los medicamentos, un 37% hizo mención de que pudo abastecerse y consiguió adecuadamente el abastecimiento de sus medicamentos. Mientras tanto, un 20% de la muestra evidencia que ha tenido problemas en el abastecimiento y compra de sus medicamentos. El 16% de la muestra, responde de que ha tenido que dejar de consumir o tomar sus medicamentos en forma regular. En relación al acceso y consumo de hormonas o tratamientos TRH, un 26% responde que no consume medicamentos en forma regular de orden hormonal. Un 25% de la muestra reflejó de que tuvo que dejar de consumir los medicamentos debido a no poder tener acceso o no contar con el dinero suficiente para la compra y abastecimiento de estos medicamentos. Esto se debió a las normativas de pandemia en torno a las restricciones de salidas a abastecimientos, o bien también se debió a que no se encontraban los medicamentos en farmacia. Impacto de la COVID-19 en torno a la salud mental. Un 29% de la muestra evidencia que ha sufrido o ha tenido episodios de deterioro en su salud mental de un nivel leve a moderado o medio. En un 18% de la muestra hace mención de que tuvo empeoramientos o episodios graves en su nivel de estado de salud mental, mientras que un 23% evidenció que no tuvo problemas en torno a la evolución y su salud mental. Distanciamiento y aislamiento en relación a la salud mental. El 20% de la muestra demuestra que está siendo una situación compleja de sobrellevar. Que otro 20% evidencia que extraña el contacto y la relación humana, mientras que el 30% de la muestra refleja de que no siente confianza y que cree que las políticas de su país pueden empeorar. En relación al apoyo de la comunidad hacia la comunidad y hacia las personas intersex, de la muestra un 60% demostró que ha podido tener contacto con personas intersex en diferentes grados. Gran parte de las personas demostraron que se sienten confiadas y han recibido algún aporte o ayuda de alguna organización o activistas intersex, o han tenido algún tipo de contacto con activistas intersex. Impacto de la pandemia en relación a la situación financiera. Un 60% de la muestra evidencia que tuvo situaciones complejas y que su situación y calidad de vida en relación a lo económico ha disminuido y se ha visto bastante afectada debido al avance de la pandemia y de la infección COVID-19. Que la pandemia es una situación que arrasa también en lo relacionado al ámbito social y económico. Aumento de los costos en relación a la pandemia, a la infección COVID-19. En relación a este ítem, las personas en un 24% indicó que tuvo gastos y aumento en relación a sus necesidades clínicas, médicas y niveles de salud. El 60% de la muestra que tuvo un aumento excesivo en torno de sus costos y nivel de vida, o sea, dejó de percibir la misma cantidad de dinero o bien tuvo una disminución en sus niveles económicos que impidieron tener un acceso adecuado al nivel de vida previo a la pandemia. En nivel de síntesis vemos como la comunidad se ha visto afectada por este efecto de la pandemia y de la COVID-19 en torno de su nivel económico, social, la disminución de sus niveles de calidad de vida y en el acceso y encarecimiento de sus niveles de salud y acceso a los medicamentos, los cuales han sufrido un incremento elevado de los precios y costos para abastecer los medicamentos y así como también las hormonas. En relación a esto, creemos que es una situación compleja y una segunda pandemia, el avance de un deterioro económico y de las necesidades sociales, de empleo y económicas que pueden sufrir las personas, en este caso de la muestra, las personas y la comunidad intersex de toda Latinoamérica, la cual se ha visto afectada por la enfermedad de COVID-19, pero también viene afectándose debido a este avance en torno del desempleo y del encarecimiento de los medicamentos y hormonas que en muchos casos muchas personas tienen y necesitan de debidos tratamientos. Bueno, de Organización Orquídea Intersexual, ILGALAC, la OII Europa, agradecemos la oportunidad de mostrar en esta corta presentación la situación general que pueden estar atravesando las personas y la comunidad intersex en toda Latinoamérica. Bueno, gracias por la oportunidad de estar participando en este encuentro.